Today, we're diving into an enemy that's as ancient as the pyramids, but is still one of the world's top infectious killers. We're talking about tuberculosis. This is one of the oldest diseases we know of, a thread that connects all of human history right up to our modern world. But this isn't just a history lesson. Tuberculosis is still a massive public health problem today, affecting millions of people all over the globe. Let's really dig in and understand what we're up against. So, who's the culprit in this story? It's a bacterium with a big name, Mycobacterium tuberculosis. This one microscopic organism is the single cause behind this immense global health challenge. To really understand TB's power today, we have to look back in time. So let's kick things off with Section 1, an ancient enemy. For centuries, this disease was just a fact of life, a feared and devastating illness. But fast forward to today, and it has a massive global footprint. Millions of people are still affected every single year. And get this, it's estimated that maybe a quarter of the world's entire population carries the bacteria in a dormant state. So this isn't history, this is very much a current event. So how does this ancient foe continue to thrive? Well, that brings us right to Section 2, the silent invasion. Its main method of attack is through the air we breathe. It's kind of sneaky, actually. When a person with active TB in their lungs coughs or sneezes or even just speaks, they release these tiny little droplets carrying the bacteria. And if someone else inhales those, the bacteria can travel down and basically set up shop in their lungs. It's an incredibly efficient and totally invisible way to spread. Now, this part is so important for getting rid of the stigma around TB. You don't get it from shaking hands or sharing a meal or from touching clothes or toilet seats. The real risk comes from prolonged, close contact in places without good air circulation, not from just everyday interaction.
So this leads to the big question, right? Once those bacteria are in the lungs, does everyone who's exposed automatically get sick?
And the answer is a definite no. This is where you can see the two very different paths things can take. For most people, a strong immune system basically builds a wall around the bacteria, which leads to latent TB. The germs are there, but they're inactive, they're sleeping. You have zero symptoms and you're not contagious at all. But if that defense system fails and the bacteria start to multiply, it becomes active TB disease. That's when you feel sick, and that's when you can spread it. Understanding that difference is absolutely key. So what is it that flips that switch from dormant to dangerous? That brings us to Section 3, from latent to active. Well, the answer is pretty simple, but it's profound. The dormant bacteria can wake up and multiply if the body's immune system gets weakened. It's like the guards protecting a fortress have been compromised, and that allows the invaders that were trapped inside to finally break out. And what kinds of things can weaken our defenses? As you can see here, it can be a whole range of things. Medical conditions like HIV or diabetes, or lifestyle factors like not getting enough nutritious food or smoking. Even just being under a ton of stress can give the TB bacteria the opening it needs. So when the disease does become active in the lungs, the body starts sending out some serious warning signs. A cough that just hangs around for weeks, a fever, waking up drenched in sweat at night, and losing weight without trying are all red flags that a serious battle is happening inside your body. But we are not defenseless. Not even close. So let's look at the counterattack. In Section 4, diagnosis and treatment. Finding the enemy is always the first step, and doctors have several tools for this detective work. They can look at a patient's mucus under a microscope, or use these amazing rapid molecular tests that can actually detect the bacteria's DNA. A chest x-ray can also reveal the damage in the lungs. Getting that diagnosis early is absolutely key. Okay, once it's diagnosed, the fight begins. And it is a long one. Just take a look at this number, 6+ months. And that's the minimum time it takes to treat standard TB. This isn't a quick course of antibiotics. This is a marathon. And this right here, this is maybe the most critical message about the treatment. You have to stick with the full course of therapy. A person might feel a lot better after just a few weeks, but the bacteria are definitely still there. If you stop early, it can lead to a relapse and create an even bigger problem down the road. To help people get through this long journey, there's a strategy called DOTS. It's basically a system of support, often with a healthcare worker or a volunteer who helps the patient stick to their medication schedule, making sure the treatment gets completed successfully. But even with these treatments, the war isn't over. There are some serious modern challenges. Let's look at them in our final section, winning the war.
So let's go back to that crucial point. What are the actual consequences if someone stops their treatment too soon?
The outcome is incredibly dangerous. The bacteria can actually evolve. They can create drug-resistant TB. The few bacteria that survive in incomplete treatment are often the toughest ones, and when they multiply, they pass that resistance on. And this table here illustrates that escalating threat perfectly. We start with regular drug-sensitive TB, which is curable. But then we face MDR TB, or multi-drug resistant TB, which needs longer, more toxic, and way more expensive treatments. And even worse is XDR TB, extensively drug-resistant, which is a true global health crisis. This is exactly why completing that first treatment correctly is so vital.
So, how do we finally win this war? By breaking the chain of transmission. The keys are right here. Finding and treating cases early, making sure indoor spaces have good ventilation, practicing simple cough etiquette, and, crucially, building awareness to fight the stigma that stops people from seeking help.
And that brings us to our final takeaway, and it's summed up perfectly right here. Early detection saves lives, completing treatment prevents resistance, and our collective awareness helps stop the spread. Tuberculosis is an ancient enemy, for sure, but with modern science and global solidarity, this is a battle we can and we absolutely